Come visit us at Urgent Care for all your minor illnesses or injuries. We are open 7 days a week from 8 a.m. to 8 p.m. I'm Dr. David Dupy of Salina Regional Urgent Care.
Doctor, thank you so much for joining me on the show and for joining Urgent Care, where you bring your 10 years of emergency department experience to the clinic. Well, let's talk about the services that you're offered at Urgent Care.
Yeah, we really have a wide variety of services we can offer. We can see anyone really from birth to 110 years old. So mainly what we do is we take care of kind of urgent complaints. So those people, upper respiratory infections, sinus infections, cough, colds. But also we can do pretty simple to moderate kind of lacerations, repairs. We do sports physicals. We'll be adding telehealth services.
Let's talk about the difference between when somebody should go to the emergency department versus urgent care.
So it's kind of in the word a little bit. So urgent versus emergent. So I tell people anything severe, you should really go to the emergency room. So a severe headache that comes on all of a sudden, severe chest pain, severe shortness of breath, severe abdominal pain, any neurological complaint that comes on suddenly. So if you get weak or numb on one side, if you have trouble speaking, if you're not acting correctly, those are things that should be dealt with in an emergency room.
Well, I know right now we are in flu and RSV season. Why don't you touch on that real quick?
So, flu, RSV, and COVID can all cause similar symptoms. So people usually start out runny nose, kind of cough, congestion, don't feel very well, and so RSV really is dangerous for babies. So there are, 1 to 2 year olds sometimes can get sick, but the real people we worry about are 6 months and under. And what happens is it just produces so much mucus, it clogs the airways, and it gets down into their lungs and they get a viral pneumonia. Kind of like COVID and kind of like flu, that's how people get in trouble with all 3 of those viruses. The problem right now is because of COVID, we are masking, we are away from each other, and so there's very little immunity to RSV because it basically went away for 2 years. And so now that we're kind of back to more normal, it's just raging. And so the problem is we're trying to kind of slow the spread of it because the children's hospitals all around the region and country are full. So if you have cough, cold, flu symptoms, especially if you have fever, the prudent thing to do is to get a test. And then if you have COVID, flu, or RSV, really to quarantine for 5 days from when your symptoms start.
Okay, thank you so much for some great information. And thank you for watching. For more information, please visit salinaurgentcare.com and like Salina Regional Health Center on Facebook. Follow us on Twitter and Instagram.